Risk of colorectal cancer after a negative colonoscopy in low to moderate risk individuals. Impact of a 10-year colonoscopy. Introduction. Colonoscopy reduces the risk of colorectal cancer, CRC, and CRC-related death, and is recommended by North American societies as a modality for CRC screening and prevention in individuals over the age of 50 years. For individuals who do not have CRC or adenomas detected during colonoscopy, negative colonoscopy, or major risk factors for developing CRC, rescreening for CRC is recommended after 10 years. This recommendation is supported by several indirect lines of evidence. 1. Cohort and case control studies have reported that a negative colonoscopy is associated with a substantially reduced risk of developing CRC for 10 years or longer among low to moderate risk individuals. 2. Randomized controlled trials in screening cohorts have shown a protective benefit of flexible sigmoidoscopy against CRC and CRC-related death for more than 10 years. And 3. Natural history and portrait studies suggest that the time to progression of low-risk adenomas to CRC is greater than 10 years. While these studies justify a rescreening interval no shorter than 10 years, few studies have evaluated whether 10-year colonoscopy in this setting further reduces the risks of CRC or CRC-related death. The very low rates of CRC observed for up to 10 years in negative colonoscopy cohorts cast doubt on the utility of this intervention at a population level. A modeling study based on a German screening cohort estimated the 10-year probability of developing CRC following a negative colonoscopy to be less than 0.5%. Recent studies have also reported very low rates of CRC and advanced adenomas during screening colonoscopy performed close to 10 years after a negative screening colonoscopy. Given the uncertainty about the utility of 10-year rescreening with colonoscopy, the authors used population-level data to study the real-world association between performance of a second colonoscopy 10 years following a negative colonoscopy and the risk of subsequent incident CRC in low to moderate risk screen-eligible individuals. Background and study aims. National societies recommend colorectal cancer, CRC, screening 10 years after a normal, negative colonoscopy in low-risk individuals. The authors studied the impact of a 10-year repeat colonoscopy on the risk of early incident CRC. Patients and methods. The authors used health administrative data from Ontario, Canada, to conduct a population-based retrospective cohort study in 50 to 74-year-old individuals at low to moderate risk of CRC who had a negative colonoscopy between 1996 and 2001. The authors approximated exposure to repeat colonoscopy using an 8 to 12-year window. The authors excluded individuals who underwent lower endoscopy or colectomy, developed CRC, or were lost to follow-up between the baseline and repeat colonoscopies. The authors matched exposed individuals 1-to-1 to individuals who did not undergo lower endoscopy within 12 years for age, sex, and calendar year of baseline colonoscopy, and followed matched pairs for incident CRC. The primary analysis was multivariable hazards regression, adjusting for competing risks. Results. A total of 13,350 matched pairs were observed for a median of 4.5 years. Interquartile range 3.2 to 5.9 years. The cumulative probability of CRC following the matching date was 0.70%. 95% confidence interval, CI, 0.42% to 1.11% in individuals who underwent repeat colonoscopy, and 0.77%. 95% CI, 0.48% to 1.2% in individuals who did not undergo repeat colonoscopy. The adjusted hazard ratio for CRC was 0.91, 95% CI, 0.68 to 1.22. Conclusion. The authors did not find an association between a second colonoscopy performed 10 years after a negative colonoscopy and early incident CRC. Our findings support the need for further studies on the utility of 10-year rescreening with colonoscopy in this setting.